Okay. Well, good afternoon, everyone, and thank you for being at you have to look at the day here, Friday, May 29th, 2020, Montgomery County Council meeting. We're going to begin today by hearing from Marlene Michelson. Ms. Michelson.
Yes, thank you. I just wanted to provide a little background and context for what is happening today. Um, First of all, to go back a little bit, as the council will recall, you were in this exact spot 2 weeks ago when a few days before the governor had announced his plans to begin opening up parts of the county. But he gave explicit authority to local political subdivisions to have more stringent rules. And our county executive, working together with health officers, determined that our data did not show trends yet that led him to believe that we should open at the same pace recommended by the governor. And so 2 weeks ago today, in the morning, you received an executive order that would keep Montgomery County closed and not open as was being suggested by the governor. You received it that morning, approved it that afternoon. And shortly after approving it, we heard from one of our municipalities concerned that the executive order did not cover them. And so what happened was that our health officer issued a directive to include the municipalities. In hindsight, had we had a little bit more than just a few hours to think about it, we would have recommended that you adopt a regulation acting as the Board of Health, which would have applied to municipalities. And that's what we're suggesting today. So to take us to this week, earlier this week, you heard from the county executive that the data was trending more favorably, that it appeared that if it continued in the same way, that he believed that we'd be ready to open phase one within approximately a week. And as you know, yesterday at a press conference, he made an announcement that he now believes that June 1st, the county government should begin its first phase of reopening with some very specific descriptions of what should open. We at the council received a draft of council staff received a draft of the executive order after the press conference today. And the final version later tonight. As you see on the agenda, we're recommending that you both approve the executive order and adopt a regulation as the Board of Health. We do have a slight change in the order that we're recommending for today. First, we suggest you do the public hearing and hear from the public. But before you adopt the health regulation, you have an opportunity to discuss the executive order and any concerns or questions you have about that. It would be silly to adopt the Board of Health regulation saying you support the executive order before doing that. We have a whole team of people here to answer any questions you may have. Bob Drummer from council staff on any of the legal aspects of this, and from the county executive's office, I believe you have the health officer, the emergency management director, the CAO, people representing their legal staff. So a whole team of people who can answer your questions when you're ready. And with that, Mr. President, I suggest you start the public hearing.
Well, thank you very much, Ms. Michelson. The only thing I wanted to clear up is that you said, I believe, that we will receive the executive order this evening. We've already received.
I'm sorry, I didn't mean last evening. Yes.
Yeah. Yeah.
Yes, it's hard to keep the days apart, but we did receive the executive order, the final one last evening. And in the packet that was recirculated to you today, there is the final signed executive order.
Thank you. Believe me, I understand confusing the days. We all go through that. And with that, we're going to start sitting as the Board of Health. And this is a public hearing on a Board of Health regulation to adopt Executive Order 070-20, COVID-19 Local Order, Phase 1. And the action is scheduled in today's meeting as well, following the public hearing. It is my understanding Susan Kennedy is going to be conducting the public hearing, and it's my understanding we have some speakers for it.
Yes, that's correct. Good afternoon, Mr. President and Council. We do have 4 speakers signed up for this public hearing, and the first one is Chris Mole. Mr. Mole, you can unmute and begin your testimony.
Good afternoon, County Council. I know this is a tough time with the COVID-19 pandemic. I am for you guys to approve the executive order, and I would like you to also see if we can amend a chances of bringing back the outdoor pools as soon as possible, as I am a swim instructor and I love my swimming pool, and it's very hurtful to see we can't go into water right now. But hope everyone's well, stay safe, and I'm happy to be back in business soon.
Thank you. Our next speaker will be Patricia Swanson.
Thank you for the opportunity to testify today. My name is Tricia Swanson, and I am Vice President of Government Relations for the Montgomery County Chamber of Commerce. I'm also testifying on behalf of my colleagues at the Greater Bethesda Chamber, the Gaithersburg Germantown Chamber, and the Greater Silver Spring Chamber of Commerce. First and foremost, we want to recognize and acknowledge the delicate balance the county has had to strike between public health and our economy. This has been no small feat. And with that in mind, we wanted to respectfully relay some of the concerns and recommendations from the business community. Like the county, our businesses want to do what's in the best health for their employees, their customers, and the community at large. Therefore, communication from the county is of the utmost importance. While we appreciate what's been laid out in the executive order, more thorough and direct guidelines are necessary. The county needs to clearly lay out by each industry sector what specific guidelines each needs to follow. And if the answer is that the CDC guidelines are what is necessary, then those need to be clearly publicized. There should be a one-stop shop where businesses can find all of this information. There should be an ombudsman or direct point of contact for more specific questions and guidance. Again, businesses want to follow the rules and want to do their part in ensuring people are safe and healthy, but they need very specific, very detailed guidance in order to do that. Further, the expected guidelines and parameters for phase 2 and future phases must be clearly communicated and publicized. While we understand that many policies and guidelines are being driven by the state, but the county's expectations for each phase must be outlined as soon as possible so businesses of all industries know when and what they need to prepare for. We also had a specific sector question as to the commercial office space sector. We're not sure what phase they fall into and how they need to start preparing. So some specific guidance on that would be appreciated. It's also our hope that the county will partner with the chambers so we can help communicate out these expectations and guidelines with communication to the broader business community. In summary, again, we appreciate the commitment from the county executive's office and the county council in balancing public health and the economy. Our chamber looks forward to future partnerships and opportunities for collaboration as we begin reopening. Thank you.
Thank you very much. Our next speaker is Sue Sabota.
Thank you very much for the opportunity to provide input on the phase 1 opening plan. I hereby request that the county's partial phase 1 be amended to follow the state's phase 1 guidelines. Specifically, retail establishments should be open to the general public at 50% capacity with safety guidelines in place. Curbside sales simply will not support a typical retailer's overhead. Of course, safety is everyone's top goal. But does opening retail to 50% jeopardize the safety of the citizens? It does not appear so, since big box retail is open and packed with people. Please forward a detailed explanation of how opening small business to 50% puts the public at risk. Please also explain why a targeted approach is not possible. Of 531 deaths, 65% were nursing homes and 84% were over 65. The nursing home should be isolated, not the community. Please explain why you are not in support of a strategy that protects the vulnerable while we open fully to phase 1. Folks under 65 are at a low risk of dying from the disease. assuming a population of 1,051,000.008% under 65 have died from COVID. I respectfully ask the county to inform the public of the number of folks who have died in this age group annually from other infectious diseases, just for perspective. Hospitalization rates are key and caseloads are higher in the young than the old. We understand that. But the county demonstrated that we have sufficient hospital capacity throughout this pandemic. I would also like to know if the county has consulted with the state's medical advisors who have supported opening fully to phase 1. Has the county consulted with other medical advisors in other states who have successfully opened to phase 1, 2, and 3 and sought their opinions? We really do need guidance on what is going to be required for you all to open to 1, 2, and fully to 1, 2, and 3.
Ms. Sabota, you're at 2 minutes.
Okay, I guess I won't finish my last couple sentences. I just will say one sentence. Yesterday was a disaster from just about every perspective, both from the citizens, and I think the county, not intentionally, but certainly came across with a bit of contempt. And I just really think that if we're all going to be in this all together, we really need to start acting like it.
Thank you. Thank you very much. Mr. President, we have no more well, wait a minute. We do have one who just got on. I want to see, we had another speaker. I'm not sure if that person is on now, but it doesn't look like it. So that is the end of our speakers for this public hearing.
Thank you very much. This public hearing is now closed. And so now we will move on to the action item, the discussion on the executive order 07-20, COVID-19, local order phase 1, as the county council. And we're going to ask Bob Drummer to please give us some background.
Okay, good afternoon. Hope everybody's enjoying their recess. What you have before you today is an executive order that was signed late last night by the county executive. And it's a phase 1 reopening of the, I guess it's a relaxing of some of the restrictions that were in the stay-at-home order that the county executive issued and you approved in May 15th. This all stems from the governor's orders, the most recent order relaxing some standards for the state, but allowing political subdivisions to keep stricter standards. And that's what happened in May 15th. And this would still be somewhat stricter than other areas in the state in the governor's order. The executive order requires the approval of the council. The last executive order expressly stated that it could not be amended without the executive could amend it with the approval of the council. That's why it's in front of you today. This executive order says the same thing, that it could not be amended, or it could be amended by the executive with council approval. So that leaves you in a situation of you can either approve it or not approve it and ask for certain amendments if you have specific amendments. If there's no approval of this executive order until it's amended and approved, the existing restrictions would continue. So there would be no reopening. As Ms. Michelson said earlier, in order to ensure that this would be effective in municipalities, last time we had the local health officer, Dr. Travis, issued a health directive, which was effective throughout the county. The method we're using today would be to have the council, after assuming that you would approve the executive order, go forward and consider the Board of Health regulation, which would simply adopt the executive order as a Board of Health regulation, making it effective in all the municipalities in the county. If you do not approve the executive order, I would recommend you defer on the Board of Health regulation and wait for an amended executive order. And there are plenty of people here from the executive branch who can answer questions about details in the executive order, what exactly is being relaxed and what the guidance is. Probably do a lot better job answering it than I would. But that's the procedure, that the procedural situation that we're all faced with right now. So if there are any questions about the legal procedures or what's in front of you, I'm happy to answer them.
Thank you very much, Mr. Drummer. I think, so everyone is aware, Mrs. Michelson is actually the executive director for the county council. Mr. Drummer is the senior legislative attorney, and I think I got everybody's title right, but I usually get them wrong. But anyhow, but I did want the public to know who was speaking. And unless there's questions of Mr. Drummer, I did want to ask Dr. Gales, who's the public health officer for us, whether or not he had any opening remarks as well. Is Dr. Gales on? No? Okay, very good. So with that, we're going to go through the council members who have asked to speak, and that's the first speaker is Councilmember Navarro.
Thank you, Mr. President. I want to thank the speakers for their testimony. And I also want to be on record stating that I'm appalled by the behavior of the hecklers and the obscenities and offensive language that was in full display during yesterday's press conference. It was disruptive and offensive. The county is following the guidelines set forth by the governor in taking a data-driven approach to reopening while adhering to CDC recommended physical distancing measures in order to minimize health impacts of COVID-19 in our county. This approach reduces the risk of COVID-19 to our most vulnerable populations, those specifically who live in zip codes that are part of my district and majority communities of color. It also preserves capacity in our healthcare system while safely opening up businesses and resuming gatherings, travel, shopping, and recreation. Now, I also am aware and cognizant that this executive order contains 17 provisions. And I know I appreciate the fact that answers to my 11 questions that I submitted yesterday, that I was able to receive those. So the one piece that I just overall, and I'm sure we all have lots of questions, but I think Ms. Swanson said it best. This issue of communication is going to be fundamental. When we think of the gigantic task of reopening our county from scratch, literally, it means that there's going to be a lot of questions, a lot of confusion, and we need to be crystal clear as to what it is that is occurring for our businesses, for our nonprofits, for our residents, for everybody involved. And so I would like to understand what exactly is the communication plan. I am sensitive that this came about very quickly, and I understand what that means, but we have got to be ready for how we communicate this, and especially as we may start already planning or thinking about subsequent phases. So in general, one of my main questions right now has to do with the communication plan. What exactly is going to happen, and how are we going to also communicate with our multilingual residents who need to know what exactly is occurring? And I'm not sure who would be here from the administration that can answer that.
Hi, this is Travis. Can everyone hear me?
Yes, Dr. Gill, we hear you.
Okay, sorry. So I'm calling in on my phone as we're at a site visit. So I apologize, Council President Katz and Councilmember Navarro. I was attempting to give an opening statement, but I was talking and no one was hearing me. So I think we figured that out. So if you will permit me, I will try to address your question, but also provide some context if that is okay in terms of an opening statement. Is that okay?
Please, absolutely, please.
Okay. All right. So thank you for your patience. I'm sorry for that. Technologically challenged, but we're working through it. But I did want to thank everyone for the opportunity to discuss this. Thank you for the community input. Community input continues to be important to us. And just to frame the steps in the executive order, I want folks at home to understand and be assured that when we put in policies, we are looking at data and science and evidence. We don't look at it in vacuums because we don't consider ourselves to be the sole experts on any of these topics. So when we come up with ideas, we study other jurisdictions across the country. We spent a lot of time talking to colleagues in other areas such as Chicago and California and New York. When we've looked at our testing strategies, we've looked to Los Angeles, San Francisco, Detroit, the state of Michigan, Chicago, New York, New Jersey, as well as our colleagues in the state and national capital region, and particularly as it relates to the metrics that we have used to determine our readiness for reopening. We have certainly looked to the measures that the state have used. We're using similar measures, and we've also been in constant communication and contact with our partners as I said, across the state of Maryland, in particular the National Capital Region, to make sure that we are moving in the right direction together. Now, so I want to also clarify another point that we are working on. We're putting this information on the public site, is a question of nursing homes. I did not have the opportunity to go into detail with that on yesterday due to the dynamics of the press conference that have been very eloquently described so far in the conversation. But to be very clear, while nursing homes do account for approximately 65% of the COVID-related fatalities, and that information, at least it's broken down by age and race on our website, they only make up approximately 15% of the COVID-related cases. And that's important because, yes, we have lots of initiatives and efforts aimed at protecting our vulnerable population, but we know that part of the risk that brings in is someone from the outside bringing that into the setting. And so when we look across the spectrum, while that it has disproportionately impacted and affected our fatality rate, over 80% of our cases are tied to individuals who don't live in nursing homes. And that's why it's important that we don't base our decisions solely on one demographic group and one pocket. So I just wanted to also emphasize that there are some differences in terms of where we are moving, in terms of where the state has moved. The governor made it very clear a couple of weeks ago that there are different dynamics across the state, across different jurisdictions, where some jurisdictions have higher case counts and they are getting hit harder than other areas. And so it necessitates them to act differently and to move at a different pace and a different speed. And so consistent with that, all of the different measures that are listed in the executive order are consistent with things that were proposed in the governor's first phase. We've actually recommended some activities that are part of phase 2 be included in our phase 1 of reopening. And the delineation of those types of activities have been our assessment in terms of what is a low risk activity for risk of transmission. Also other factors in terms of activities that may promote other components for enhanced transmission. So for example, what are activities that may promote congregating and making it difficult to adequately physically distance from participants? And those are the kinds of things that could enhance transmission. Now, certainly as we continue to move forward and we continue to use the same metrics that we have used to guide this step, we will continue to monitor those numbers, and as they continue to improve, those activities will be added onto the list. So just briefly looking at the measures that have been pointed out, starting with the first one, the gathering of larger than 10 persons prohibited. That is consistent with the governor's directive, as well as our colleagues across the National Capital Region. The next item, drive-in religious services. This does include provisions for, we continue to support virtual meetings for churches and religious services. Also, this allows provisions for some flexibility and creativity in terms of being able to have gatherings in some form. But again, they are consistent with the large person prohibitions that I just mentioned. That does cap the ability to have outdoor and indoor gatherings outside of that number. Now, the next question is, the next item is retail establishments. We have introduced the concept of curbside retail. Now, it's important to note, again, this is another opportunity where there may be opportunities for growth in the next phase. So as we continue to see improvements in our numbers, that opens up the possibility of expanding beyond curbside retail to opening up in-store retail with restrictions based upon square footage and capacity. Again, the recommendation for businesses would be to make sure that they have the safety procedures and protocols in place similar to what we asked our grocery stores and other retailers to do some time ago, including physical distancing, protections for their employees, face coverings, and those types of policies. So moving to the next one, manufacturing. It's clear manufacturing businesses and facilities are allowed to open with strict requirements as listed below or on the executive order in terms of maintenance of physical spacing and protections for their staff and employees. Certain personal services are included, hair salons and barbers by appointment only, with strict restrictions and requirements based upon physical distancing and spacing, as well as making sure that individuals wear face coverings throughout those appointments. Now, there is some difference. You know, some folks have said, well, why hair only and not nail salons? Based upon looking at risk of exposure, the determination was that providing those nail services and so forth has a different level of proximity. And again, as we move forward in the next phase, that would present an opportunity to include those types of activities as we expand and move forward. Similarly, when we look at food service establishments, right now our provisions would allow for outdoor dining that allows for adequate physical distancing. And again, if numbers continue to move forward, the next level of opportunity would provide in-restaurant services, again, with adequate physical distancing and other procedures and protocols in place. Now, there are other provisions for outdoor recreation as listed, and what has been included in this is all consistent with the governor's directive at this phase. In addition, there have been provisions for outdoor day camps to be put into place with restrictions, limiting the number of participants, as well as outdoor youth sports, again, with requirements and restrictions for the number of participants and the type of contact involved. There are provisions for other businesses as well, from car washes with restrictions, farms to allow for picking your own produce type activities as well with restrictions and requirements. And one thing that I did hop over is childcare. Childcare providers may reopen for the purpose of providing childcare for dependents of essential employees. And there are restrictions and requirements put into place for those activities as well to maintain practices that mitigate transmission. Now, one of the other issues that has been brought up is the issue of fitness centers and swimming pools. At this point, swimming pools remain closed. However, as we have discussed in previous conversations, we're recommending that all pool owners complete their maintenance process, complete their inspection. And what is likely to happen is in the near future, again, if numbers continue to move in that direction, the next phase could potentially include reopening pools in some capacity to be able to provide lap swimming, for example, but minimizing opportunities where there may be congregation, spending time by the pool, those kinds of things. The team licensing and regulatory services team is continuing to work on language and guidance for what that may look like. But we do anticipate that, again, if trends continue to move forward, we are simply not there where the state may be in other jurisdictions, then those types of activities where it's deemed to be a lower risk of transmission will be added to our portfolio of things that we're reopening. I think I've gone through and covered all of the different items in the executive order and tried to answer and anticipate some of the questions that may be asked, as well as some of the questions and concerns that were brought up in the opening comments. I will stop there, but happy to answer any questions. And again, apologize for the technical difficulties.
Not a problem. Thank you for being here. Councilmember Navarro, had you finished your questions?
Well, so I would like to know what is the communications plan for this particular order, which contains over 17 provisions. Just want to understand if I'm a constituent and I'm wondering what's in, what's out, if I'm a business owner, exactly what is the actual plan to ensure that the public understands clearly, and business owners, et cetera, also understand the nuances and how will they receive technical assistance if that is necessary. And I have to say that the one thing that jumped out at me was the childcare provision. Having been a childcare provider many moons ago, the fact that it's requiring face covering for children over the age of 2, understand the health implications of that. But in practicality, very curious as to how in the world is that going to be done. So communication, and then some of the specifics, what is the technical assistance process to clarify any doubts?
Dr. Gales?
I believe.
Sorry, I was okay. Is there someone from the comms team on the call? I'd be happy to.
Yeah, I believe Julie's on.
Hello, good afternoon, council members. Hope you can hear me without too bad of an audio issue. So the executive order and the phase 1 one-pager graphic is posted online, explaining to people the changes that have been made or will be made starting Monday, June 1st at 6 a.m. The executive order, as you know, breaks down the various specific items that everyone is to follow. Earlier today, we met with the business team to make their final edits on a checklist for both retailers and for restaurants, so that everyone knows what's to be expected of the business itself, and so that we can speak directly to those retailers and restaurants in terms of county expectations and what they need. There is a set of guidelines for them to print and hang inside their establishments, so that these guidelines are made public for everyone. The special populations team, with whom we work closely, has, I believe, already translated those documents, and there is a recovery webpage that is in, if it hasn't already launched at this hour, will be ready to be launched today. And that breaks down further guidelines about items such as pools and what is or what is not open, pools not being open, camps, manufacturing. We break down all of those phase 1 items so that people know what is available beginning Monday. We're in the process of developing the appropriate graphics for phases, phase 2 at least, potentially phase 3. I think that one's a little not quite as far along as phase 2. Again, working closely with the special populations team on that. And then on the social media front, we are constantly gathering the primary questions that we're seeing both there and through MC311, and then responding to that. So for example, as of the announcement yesterday, pools was a very big topic of conversation. And because we are not aligned with the state, that creates a messaging challenge. So we are putting together a release for today about pools, some of which will contain information that has been previously released. But this is the kind of thing where you can't over communicate because there are messages coming from all over the region, frankly, all around Maryland and all over the region. People are hearing different messages. And when they don't always hear the whole thing, or they don't always read the whole thing, it makes it obviously a communications challenge. So our guidance on pools, and I believe we're going to have the camp piece in there as well, will also be going out today. And as we lead up to Monday itself, we will continue to push out and watch for the most requested bits of information and then respond to those accordingly.
So, so what I'm hearing is basically, you know, a pretty boilerplate communications plan that has been pretty much utilized up until now. I'm curious as to what will be the sort of technical assistance portion of this. So, other than pushing out, you know, what the executive order includes, et cetera, which is pretty straightforward, but then how are we going to help those who need to understand the nuances of all of this? Is there going to be a team dedicated to this? Is it 311? Is it, I mean, taking it a step further, other than basically your boilerplate sort of publicity angle, what are we going to do? What is planned for a real thorough communications plan that includes that kind of technical assistance and also obviously responds to all the needs of our complex county?
Well, if I'm understanding correctly, this might fall into what you're asking. There is a teletown hall that we are scheduling that will be able to accommodate thousands of people to ask the kinds of questions that we're seeing, and for us to be able to respond in a different sort of manner. The special populations team this evening, as you know, has a town hall going on. Am I on the right track? Is that what you're requesting?
No, but I will, you know, I'll just, I don't want to take up all the time because I know my colleagues have a lot of questions. I'm talking about something a bit more thorough in terms of technical assistance and those types of things, but I will send that.
I'll.
Thank you.
This is Earl Stoddard. I'd like to chime in here. We are going to have a single point of contact. We will likely have an email address and not a phone number over the weekend, because some of these questions require us to do some conversation. We expect that there'll be questions that will just require us to have some discussion. So giving a real-time answer for some questions will be very difficult. So we will provide a single point of contact available this weekend for businesses who wish to ask questions. We'll make sure that we can provide the answers in a multilingual format, so they can ask and be answered in a multilingual format, to make sure, because we know there will be questions. We can't possibly anticipate all questions that will be asked, but we want to make sure that we can respond in near real time to the questions that are being asked in a really constructive way. I would only add that we're very much going to be working with the businesses. We understand they've been under extreme hardship. We're not looking to be punitive in how we administer these guidelines. And so even there are occasions where, you know, businesses are going to do what's in their best judgment. And, you know, we may come in and say, well, that's not perfect, but we're not going to cite them for that. You know, as long as they're putting a good effort towards addressing the issue in a constructive way based on the way that their business is formatted, we're not interested in penalizing them or, you know, disrupting their business in any way.
Thank you, Dr. Stoddard. I look forward to the email and all that information. Thank you, Mr. President.
Thank you very much. Councilmember Reamer.
Thank you. A couple of quick points. So first of all, I think it's worth reiterating, Dr. Gales, as the county's communications have done, that telework is still required. I believe I'm correct about that, right, Dr. Gales? Like if you can telework, you're still required to do so?
Yes, telework is still encouraged. I'm sorry.
Thank you. And then masks are still required? How are masks? Can you just reiterate for us now, what is the policy on masks?
Sure. So masks are still required in spaces that are, where physical distancing is difficult to maintain. That's consistent with the state and CDC guidelines, and that includes in any of our retail spaces, our food service spaces, our workplaces, et cetera.
Thank you. So I am supporting this because I think that outdoor is safer than indoor. And that's the crux of most of these allowances, is to allow people to receive services, to conduct commerce in an outdoor setting. I think the prospect of, I don't know how much good it's going to do to allow camps of 9 kids and 1 counselor, but I hope it will turn out to be, the possibility that we would have an entire summer with 0 camps is a very difficult situation for a lot of families to be in. So I think that generally these measures are focused on outdoors, and outdoors is safer than indoors. I do want to raise a concern. I think we're going to need to come back next week for some additional work on the religious gatherings issue. If I'm reading it correctly, it seems that a larger number of people could gather for dining outdoors than for attending a religious service outdoors. So I know this is a work in progress. I think we may need to continue to work on some kind of guidance so that we could be confident that a gathering would not involve personal contact, people hugging and things like that, because that obviously would be a concern. I also want to say that we as a county government have to be prepared for the possibility that additional opening in the state, in the region, and in the county is going to lead to an explosion of cases. That is a possibility. If that happens, we have to be prepared to close up again. I don't know if that's going to happen, but we are all here as a public health body, and I think it's worth keeping at the front of our mind that we are seeking to enact something here, believing that it will not cause an explosion of cases. That is my belief, that this limited allowance will not yield an explosion of cases. I'm afraid that it could, but I don't think it will. If it does, we're going to have to take additional measures to restrain the transmission of the virus. Final point I want to make, we have gotten some inquiries from the county breweries and wineries that they operate restaurant-like services, and they just want to ensure that they are included, as the specific language of the resolution is that they are restaurants or bars or similar businesses. So I guess I'll address this to you, Dr. Gales, is that, and if you're not the right person to ask, that's fine. Are we sure that breweries and wineries are covered with the similar businesses language?
My initial response would be that yes, they are. We can, circle back to just confirm, but my initial understanding impression is that they would be covered in that.
Thank you, sir. Appreciate that. I think that's sufficient, for proceeding. And if we need to do additional work, we will. But I think it's very plain and clear that these are similar businesses. So I just think it's worth stating on the record, and then that can be resolved. Thank you very much.
Thank you. Dr. Gales, can you please clarify whether telework is required or recommended?
Well, at this stage, telework is still required where possible. And as we move to phase 2 and phase 3, those provisions would be relaxed and move from required to encouraged, where accommodations can be made.
But as of, for this executive order, it's still required.
Yes, there would be no change to the telework policy based on this executive order.
Okay. I just wanted to be extremely clear. We didn't want to have any questions on that. Thank you. And next, Councilmember Friedson.
Thank you, Council President. I am wanted to first reiterate what Councilmember Navarro said about some of the comments made yesterday. I wanted to just echo and associate myself with those comments. There is no place in our community or any community for referring to elected officials as Nazis and other similar comments that were made. I know they were deeply disturbing to many of us, and I just wanted to echo those comments as well. There's certainly reasonable disagreements on all of these issues. Everybody is trying to do their best to balance these very difficult issues in an unprecedented moment that there really is no playbook for, but that is not the way to do it, and there's no place for it. So I appreciate those comments. I wanted to associate myself with them. I am pleased that we are entering this phase one, that the curve has been flattened to the point where it is safe to do so. I think that we all recognize that this virus is not going away, and that our residents and businesses deserve a lot of credit for the very difficult but necessary changes that they have been forced to make in order to keep us safe. Those changes will still continue. They're just changing and evolving and adapting as this dynamic adapts, and I hope that we will all be committed in a collaborative way. And I think the public hearing reflected the interest of residents and businesses wanting to work together to protect public health and to take the necessary measures required. I did have a few follow-up points from some of the questions that were asked. The first is in terms of the ombuds person and the email. When will that be available? How will residents and businesses know that it's available? And where should they be looking for it in order to identify how to contact to answer these questions? Understanding that businesses have to be prepared to open at 6 a.m. on Monday morning, and it's already Friday afternoon, so we need to be moving quick.
Councilmember Freed, this is Earl. We'll provide it today, and it'll also be found on the recovery web page that, as Ms. Parker alluded to, will be up if it's not already up now. It should be up. I mean, I could look while we're on here to see if it's up or not, but it'll be available and it'll be posted prominently on that website. We'll also send out social media information about it as well, and we'll share it with council offices so you can share it with your constituents as well through your various touch points. It'll be available this afternoon. We just want to make sure that we've got appropriate staffing for it to make sure that it's operational and that we have a process for them to turn around and get the guidance, because we just do anticipate there will be some difficult questions. That said, we know that there will be questions even after Monday. And where there are questions, we're not looking to produce enforcement that, you know, if it's because of a lack of clarity from the county, we're not going to enforce something that we didn't tell someone they needed to do or clarify that they needed to do before today, obviously. So I think businesses should proceed putting their best foot forward and ask questions where they aren't really sure. But as long as they're attempting to follow the CDC guidelines, I think that they are in a very safe space, and we are not going to come down harshly on them for attempting to follow those guidelines.
I appreciate that. I think that's a really important point. The goal here is to get everybody to comply for safety reasons, not to catch people doing things that they shouldn't be doing. I appreciate your focus on that. And I appreciate you sharing it with us. I think it's important that we get this out as quickly as possible so that folks know where to turn to and that we can help them have their questions answered. Similarly, for the checklist for retailers and restaurants that was noted previously, and the set of guidelines to print and post, when will those be available and how will folks know where to find them?
I believe Julie may have a more recent update than I do, but those should be up on the recovery page as well. And frankly, when the recovery page goes live, just make sure that all the council members are aware of that and your staffs are as well, so you can pull information directly from there and utilize it as part of your own messaging. So I think that will help as well. We'll publicize the launch of the webpage, but obviously you all knowing about it will allow us to extend that reach out beyond just the county. Great.
Yeah, I appreciate it. I think we're all interested in getting the message out as broadly as we possibly can. Similarly, on the graphics that are being developed that we heard about for phase 2 and possibly even phase 3, 2 questions. 1, when would those be available? And 2, the content of phase 2 and phase 3, if that's already been determined, has that been shared with the council of what would entail in phase 2 and phase 3?
It has not been shared with council. It will be shared before it goes live. I produced as Dr. Gales will attest, I produced a list based on what the state and the district has in their phase 2 to try and give maximal alignment, recognizing that, until the governor announces it, some things we can't say if definitely will be part of our phase 2, obviously, but we want to provide as much lead time as possible so that we're not providing 3 or 4 days of lead time in the future. The goal would be for us to provide something to the council no later than Monday for you to review, and then that will be posted on the website once we come to an agreement. And that would include at least, it would include both phases 2 and 3. And, I'm looking at a draft with my own eyes as I sit here and testify here today. It'll be available for phases 2 and 3, just with the clear recognition that we're going to learn things in phase 1 that we want to apply to how we do things in phase 2 and phase 3. And so we want to provide the lead time to the businesses so they can start to get ready. But we also recognize that, this is going to be a learning process for the county. And we're also being very observant about what's going on nationally when people do various activities. And so, if there's an opportunity to make things safer or more efficient for our businesses, we're going to take those opportunities, which will mean that certain parameters will shift both in favor of more flexibility or in some cases in favor of safety. And it just will have to be that way until we get closer to the launch of phase 2.
Yeah, I appreciate it. I think that obviously adaptability is important and flexibility is important, but we also need to provide enough lead time for folks to make the necessary adjustments. I mean, this has really disrupted people's lives and their business operations, and I think understandably so in order to save lives, but we need to provide them as much information as quickly and comprehensively as we can in order to allow them to prepare to return to the changes that we're going to be putting forward. I also think that if we're at the point where we're beginning to put graphics together for phases, that the council really needs to be included in those conversations and aware of what's being discussed. And I would hope that as soon as that is ready, no later than Monday, but sooner if possible, would be really helpful and appreciated for us to be able to do our jobs as part of this as the Board of Health. So I appreciate that and appreciate the comprehensive help. And I just can't reiterate enough, the communications has been really a theme of everybody's comments. And I would just reiterate that many times over, that we need to be able to ensure that residents understand what we're doing and why we're doing it and how we are going to enforce these rules as we move forward. So thank you very much.
Thank you, Vice President Hucker.
Thank you, Mr. President. And thanks to Dr. Gales and Dr. Stoddard. Well, this has been an unprecedented challenge and experience, and we're all doing this, as has been said, with no manual to follow. I appreciate the need to reopen the economy, but we're all focused on not doing that at the expense of public health. So let me just share a couple concerns about how we move forward with the understanding that we're going to move forward. We have a big and demographically diverse county, and I appreciate that. And I realize we have different outcomes, health outcomes, in Dickerson and Damascus than we do here in Silver Spring. But I'm concerned about how this will impact the most vulnerable areas of our county, which are already being hammered. And Councilmember Navarro and I represent the communities that have been hit the hardest in 20902 and 04 and 06. They have so many Black and brown residents and others who are statistically more likely to be affected by this, already are, statistically more likely to have pre-existing conditions and to have lousy or no health care, to have, in many cases, no primary care physician. We need, if we're moving forward today, we need to continue our outreach there and to our investment there and to continue to focus on them so they don't bear the brunt of any more increased community transmission through our action today. And second, I want to make sure we're focused on equity in our workforce as well. A recent survey showed that 92% of college-educated workers were working in April and 20% of high school-educated workers. So loosening restrictions now, we all know, is going to push more service workers into the economy and back onto the front lines. And statistically speaking, they're the ones who are most likely to be exposed. They don't have the luxury to be on Zoom calls all day. So it's incumbent on our employers we're all familiar with the spacing guidelines and the arrows in grocery stores now. It's going to be incumbent on our employers that are reopening to provide the training, the spacing, the logistics, the PPE that their workers need, and to provide paid sick leave, and to urge any workers who feel sick to stay home. I talk every week to service workers who feel sick, but they are constantly still forced to either go into work sick, or to, and many of them, of course, don't want to complain to us or complain to their employer. They don't want to lose their job. So employers need to do the right thing as we're reopening. And large private employers should be considering hazard pay. It was announced today that McCormick Spices, a great Maryland company, is going to provide hazard pay, continue to provide hazard pay through June. But the Giant and Safeway, who have been providing hazard pay, two of our biggest employers who are subsidiaries of large, very profitable global corporations, they are ending their hazard pay this week, today or tomorrow. And that's a problem that I think large employers should continue to provide that. And it's also incumbent on landlords, especially those with senior residents, to provide masks and gloves and take precautions in common areas and elevators. This doesn't affect them directly, but this means more residents going out to restaurants and elsewhere, increasing potentially community transmission, and then coming back to crowded apartment buildings and crowded elevators. So residents should know if your landlord isn't providing masks and gloves and other things, especially in senior buildings, you should reach out to us. My staff had to work with Earl's staff to provide them in the charter house this week, and there are many more that don't have those kind of protections in place. I know there's tremendous political pressure to reopen. We've all been insulted and harassed. Other counties in Maryland have had, their elected officials have had death threats. We shouldn't be considering the political pressure. We need to be, forging the best path for Montgomery County. We've always been a public health leader, and I don't know that we need to perfectly align with DC or Prince George's. We need to be doing the best thing for our residents. We don't want to repeat what happened in Lassen County, California, where they've loosened restrictions, then they've had a resurgence, and they've had to tighten up the restrictions again. I want our economy to reopen, obviously. I want our businesses to succeed. I'm in daily conversations with business owners that are hurting. But nothing, as Andrew Cuomo said in his press conference, I think yesterday, nothing's worse than death. This isn't about striking a balance. It's about reopening in a strategic way that mitigates against the risk and doesn't increase our outcomes, our illnesses. So I think we need to support our businesses in other ways, in particular, expanding the public health emergency grant program, implementing it much more quickly, and the state needs to greatly expand the meager business support program that they've put together that was closed within a day or two. There would be nothing more detrimental to our economy if we reopen in stages and then we have to dial things back. So, this is not an ordinary matter. I'm more confident about my views on transportation or environmental matters. And I'm comforted by the fact that Dr. Gales and Dr. Bridgers support the county beginning phase 1. So I can support the executive order, but I just want to say I have some concerns. Those are things I think we need to keep our eye on. And if the metrics don't improve or they become worse, we need to be ready to go slower on phase 2. And we may need to be open to renew restrictions. I hope we never have to have that conversation. Thank you.
Thank you very much. Councilmember Rice.
Well, thank you very much, Mr. President, and thank you to my colleagues. Let me start off, and I hope Dr. Gales is still on the line, because there were a lot of questions that I got dealing specifically with if hair salons were open, why aren't nail salons open? I had a former delegate reach out to me and ask me the same question. And so let me just be very clear and kind of give you guys a little bit of guidance from a unique personal perspective. Many of you know my wife had a hair salon or has a hair salon and also had nails being done at one point. That's a very intimate service, done at very close proximity. Requires folks to be even closer because they have to be able to see the cuticles, see all the work that's being done. And so it requires a much closer proximity than it ever would for hair. You can actually, and it's about forward facing versus reverse facing. There are actually ways in which, and my wife has been exploring this, strategies in which even through shampoo bowls and where the person is positioned, you can actually still be behind the person. At that point, you need to wear face shields, et cetera. But I want to make sure that folks who are listening understand that there's a lot of things that go into this. And any woman or man who goes in to get their nails done knows exactly how close they are in proximity to the person. Yes, certainly they've always worn masks and worn gloves, but the reality is that there is much greater likelihood of there being some sort of transmission. And so from that perspective, it's incredibly important for us. And so I just wanted to share that personal insight with folks, and the reason why there is a differential between what happens in our nail salons and what's happening in our hair salons. But I did want to ask the question, Dr. Gales, and make it very clear, because I don't think that folks understand about pools. And we just had a conversation about this. So I want to make sure that our public has an opportunity to hear as well what some of folks' concerns are. And from my perspective, certainly the case of being in a crowded area to where you can wear a mask versus an area where we understand, obviously, you can't wear a mask when you're in the pool. And so a child, young person, older person who gets out of that pool and then sits down on their chair, assuming that they have chairs there, or sits down by the side of the pool, and then has a person who's swimming right around them, and they haven't yet been able to put on their mask there. It seems like what would be referred to as a petri dish of transmission. And so I want to ask Dr. Gales, is that what the concern is with opening pools, and the reason why you'd like to see less of the likelihood of community transmission go down before we open something like this? And also keep in mind that a lot of our public pools are places where folks who are of lower income oftentimes go as a means to be able to get out of the house, be able to have something fun for their children to do. I know that at Germantown Recreation Center, where we have a pool that's outside, is predominantly frequented by people of color. It's very clear. And so we've seen the numbers, as we had a person who was on the line and talking about science and numbers. Well, the science and numbers don't only just say that they're older people, but also say, especially here in Montgomery County, that they're people of color. Also in the state of Maryland, that they're people of color. And so from that perspective, it also is a concern from a racial aspect and ethnic aspect as well, when it comes to ensuring safety and not putting more of those people who already have a higher proclivity of risk at even greater risk. So Dr. Gales, I'll just ask you if you can opine a little bit more on the pool situation for us.
Okay, I think I'm off mute now. Can you hear me okay?
We can.
Okay, thank you. So I don't have much to add beyond what Councilmember Rice mentioned, other than to say that, I want folks to understand that we want to open up and create opportunities for people to enjoy all sorts of things, whether it's business, recreation, personal services, exchange of commerce. But when we come up with policies to, I think it was Councilmember Hucker's point, we're a very diverse county. And so when we put in policies, it has to be fair and equitable across the board. So for example, when we're looking at pools, when we put out a pool policy, it's for private pools, it's for public pools, it's for all, for everybody. And so we have to make sure that everyone can enjoy those activities safely in a way that mitigates transmission. As it relates to pools, as pointed out, part of the concern with pools is the opportunity for congregation. I think if you look at, I think it was the state of Arkansas, where the governor came out over the weekend and said, hey, they had to walk back some of their previous bravado around, saying we don't have social limits in place, we're able to move forward. There were a number of examples that were tied to pool parties, that in spite of restrictions that were put into place, folks still congregated in that area, and a significant number of cases were spread based upon those events. Now, as we move forward and we continue to explore the opportunity to bring some of those activities back, well, certainly it creates a space to look at some best practices to explore how to do those things safely. So, for example, some of the things that have been discussed and talked about, we're not ready to do it, but as you're right, we want to see the numbers continue to come down because to Councilmember Hucker's earlier point, we don't want to go backwards. We don't want to see cases spike up, and we don't want to promote activities, particularly now when case counts are still on the higher end, that would promote transmission. So as we move forward, to Councilmember Rice's point, as we introduce strategies for it, we're looking at best practices how to move safely. So, for example, requiring people to bring their own equipment to pools in later phases, such as lawn chairs, things like that. And in the first phase, having only lap-only swimming so that, people can do the activity, but it doesn't promote or enhance any type of congregating by the pool that could, as you mentioned, since you're not wearing masks in the pool, could enhance transmission from person to person.
So thank you very much for that, Dr. Gales. And just lastly, Mr. President, if I could just address one other piece, which is folks talking about the county moving too slowly and that somehow we want to keep businesses closed. Let me just be very clear. As the husband of a business owner here in Montgomery County who has been shut down, I don't think that I want or anybody else who's on our council wants to keep our businesses closed. We have our own reasons for why we want to ensure that everything is safe, and that's because we all care about our constituents. The reality is that Montgomery County, who's always criticized for having stringent tax policies and taxing businesses so much, well, we don't get revenue if businesses aren't open. Let me just be very clear. And so it seems counterintuitive that we would want to keep businesses closed just for the sake of keeping them closed. But at the same time, we're tax and money hungry and want to make sure that we get all the revenue. Those two statements just don't go together. And so let me just be real. We want to open businesses. We want to make sure that people have the ability to be able to make a go of it and try and still survive in this depressed economy that we find ourselves in. But we also have a duty. There's a reason why we also sit as the Board of Health. We also have a responsibility to ensure the health and safety of those people in our community, all people, and even more so for the people who we know are medically vulnerable. And so by people saying that we somehow should separate out the older folks in our community, well, let me just remind folks, the largest growing sector in Montgomery County is our people who are seniors. We've always talked about this statistic and said it's the largest growing sector. It's the reason why we continue to have multitudes of specialized housing, specifically for our senior population. So again, we're talking about a significant part of our population that we need to protect. And so from that perspective, I just hope that folks understand that there's a balance. There's a balance there, and I think that we're trying to do it. I think that this phased approach makes sense in accomplishing that. As a person who supports small business and wants to see small business thrive, we're starting to go in the right direction, but we need to be cautious because I will remind folks, all of those small businesses, right, that we talk about, if you look at the statistics in terms of who operates those small businesses, there are a lot of folks that are people of color who are also, again, at higher risk that we've talked about. And so what Councilmember Hucker was talking about, what Councilmember Navarro was talking about, I couldn't agree with more. We have to be real about that also and say that the same folks that we're allowing to go back into, the fray are the same folks who are of higher risk. And so that's always a concern and is why we have such a measured approach. And so I hope that folks understand that. I hope that folks appreciate that. And I will be supporting this. I think that it's the right way for us to move forward. Thank you, Mr. President.
Thank you. Councilmember Albornoz.
Thank you, Mr. President. I clicked my button late this time, but very much appreciate all of the very thoughtful comments and questions from all of my colleagues, because I agree with everything that's been said thus far. We know there is a lot of emotional and economic pain out in the community. We are getting the constituent calls. We are feeling that pain, and we acknowledge it and respect it and are doing everything that we can to mitigate it. But the bottom line is this virus is just as deadly and contagious today as it was at the beginning of March when it first came into our community. And while all of the measures that we have taken into effect until now have mitigated that risk and put us in a better, still not perfect by any stretch of the imagination, but better position to address the virus, that's why we are in a position now to take this next phase, which I fully support. And I do have a couple of questions and comments, though. We've made this comment before, and we've heard before that a number of jurisdictions are finding out in real time during the governor's press conferences critical information that local jurisdictions need to have in order to be able to effectively plan. And that is a problem. We are working collaboratively with the District of Columbia. We are working with Northern Virginia, and we have a large state with a number of complex issues. But that very basic level of communication is very important for us to be able to plan and coordinate moving forward. I don't know who from the administration is in the best position to respond to this question, but has this issue been raised, and what are we doing about that issue?
Is Mr. Klein or Earl Stoddard?
Yeah. It's a hard question. So, yeah, I mean, we are working closely with our regional partners, as you alluded to. Obviously, Northern Virginia is beholden to what Governor Northam does for the Virginia. The district obviously gets to decide for themselves how they move forward as they're treated like a quasi-state, and obviously the governor of Maryland will act as he does, and we will, try to follow his leadership where appropriate based on our metrics. But yeah, I mean, it's certainly a hard issue in that, there are a lot of factors in play, and meaning that the interests of Virginia are not necessarily the same interests as Maryland, nor are the interests across the state of the Maryland or the metrics across the state of Maryland the same as they are in Montgomery County. So what we've attempted to do is sort of balance those two things out. Obviously, having complex messages where there's disparate messaging between, what we're doing in Maryland, what they're doing in the district, what we're doing in Virginia, does not work in our favor. And we recognize that. So the extent that we can align things together, we do. We also have to recognize that our metrics are not the same as Arlington's metrics or the district's metrics. We've had a acute care bed disparity long before COVID-19 arrived, and therefore, because of that long-term issue, we are in a different place in some of those metrics than some of our neighboring jurisdictions. And so we absolutely need our public to understand that while we are trying very hard to be aligned with our regional partners, we can't allow our alignment with regional partners to force us into things that are not safe or appropriate in either direction. And so there are cases where we may go ahead of some of our regional partners because we feel more comfortable in that area. And there are places where we will lag behind the state, the district, or Northern Virginia because based on that particular area, we're a bit different. And we just, it makes things complex, but we think it's the appropriate thing to do.
I appreciate that. I do think that we need to continue to follow up with the governor's office so that we do receive information prior to, where possible, press conferences so that we can plan accordingly here, because there is understandable confusion within the community as how the state regulations relate to the counties. I concur with every decision we've made thus far, but it further complicates, in my opinion, in unnecessary fashion, the communication to our residents. And I'll jump to that. Yep. Thank you, Dr. Stoddard. I'll jump to that point next. Dr. Stoddard, I so appreciated your comments to our business community about not wanting to be punitive, about standing up a more specific customer-friendly phone number, email address that people can go to regarding nuanced questions, because the footprint of each business is different, the fabric of each business is different, and the needs of each business is different. And to that end, we know that even now, the disproportionate number of cases are concentrated in certain zip codes where there are larger communities of color. And we know also that there are a number of incredible multi-ethnic businesses in those communities that speak multiple languages and feel more comfortable speaking in those languages as their primary languages. Could somebody please describe for me what the specific plan will be as we roll out these individual phone numbers, this ombudsman-like format, but taking into account those multiple languages?
Sure. So obviously, what the way to work is, I think we'll start out with an email address, because I think our biggest concern is getting someone on the phone and not being able to give them a great answer, because we just haven't thought through a particular nuance of an issue as it relates to a particular way a business is set up or way it's administered. So obviously, we'll take questions in and then convene, obviously based on what the question is, convene with the appropriate partners to create an answer. So they can come into multiple languages. We'll get them translated for our use to make sure that we're receiving the question correctly. We'll work to get an answer, and we'll have the answer translated back and provided back via the same email that was utilized to send it in. In addition, and we haven't talked about this in terms of the enforcement part, is we're going to have some additional what we're calling ambassadors who are going to be out in the community starting next week. They would include multilingual components, and we'll obviously align the multilingual components with what information we have about languages spoken in various parts of our county to work with the businesses in the arena. So they're not, like I said earlier, their goal is to not be, they're not enforcing in the same way that you think of. They're going to be out and they're going to share information, make sure, take a look, and if there's a business they come upon where they can provide some guidance or information, they'll do so. And then they'll, schedule a follow-up to make sure that, hey, is everything working okay? Is what we suggested working? And just to, make sure that we're documenting what we've learned from that process. The goal would obviously be, and I think that I want to talk about sort of one of the things that I believe it was Councilmember Hucker raised in terms of we want to make sure that the businesses, the employees on the back end are protected in the same way that the customer on the front end is protected. And so I know that those going to a restaurant, we think about the patron. We don't think about what happens in the kitchen with the employees, and are they appropriately protected in that venue there too. So the role of these ambassadors is just to go and get a sense of how a business is operating, make sure that they have the right guidance and materials to be operating both on the front end where what the customer sees, but also on the back end where the employees are. Even on curbside retail, they can be operating safely at the curbside, but may not be operating safely inside the store when they're putting together the orders. And so we want to make sure that they have the appropriate equipment guidelines there. Again, not to be punitive, not to be trying to shut a business down. That's not our interest. We want to make sure businesses stay open. We just want to make sure that they have the right supplies, guidance, information to operate safely.
I appreciate that, and I will follow up with you on this specific point because I have some suggestions and ideas, and I'm sure a number of my colleagues do as well. We have a lot of assets in the county. We have our regional service center directors. We have our multi-ethnic chambers of commerce that have a lot of trust within these communities that I think could be leveraged to help expand the reach of the administration to be able to reach these businesses that desperately need this information. Final two questions. That'd be great. Thank you, Dr. Stoddard, and we'll follow up with you on that. I appreciate and agree with the direction for businesses. Clearly, we need to have a more nuanced approach in how we reach out to them. There will be a lot of questions from employees too. And so to the degree that at which we can provide in the same fashion that we're providing guidance for businesses, guidance for employees. We know that employees who have continued to work throughout this entire pandemic are more at risk. And as we improve or expand businesses, I think that will be very helpful to provide in addition to the information for the businesses and on a parallel track. And then I guess finally, if we could talk a little bit about, you alluded to some of this earlier, Dr. Stoddard, but anticipating a phase 2 and 3 further upstream based on all of the information and feedback that we have received, I think we'll be in a better position in days, if not weeks from now, than we have been in the past. But I think, proactively providing some level of information so that people can begin to anticipate and prepare and plan as best they can would, I think, be appropriate. So just to sort of reiterate that point, which I know a lot of other people have raised as well. Thank you, Mr. President.
We agree.
Thank you very much. Councilmember Glass.
Thank you very much, Mr. President. Thank you for everybody for the conversation. I appreciate the measured and thoughtful and data-driven approach that we're taking here. And regarding the data, a lot of people have been asking me about the metrics and our dashboard and how that aligns with the state's metrics. And so Dr. Gales, really the only question I have is, can you explain how our metrics align with the state's, how their own dashboard is aligned with the measures that the state is taking? And I'm asking this for public consumption because there's a lot of confusion out there.
Sure. Can you hear me okay?
I can hear you now.
Okay, awesome. Well, I think the basics of the state dashboard and our dashboard is, I think for folks at home to understand is, when we're looking at our data, we're looking just at Montgomery County. And so, as has been pointed out, we have a higher percentage of cases than nearly all of the jurisdictions in Maryland. But when you look at the state dashboard, that is influenced by other jurisdictions that may have lower case counts in comparison to us. So as a result, the overall state data looks a little different from ours. Now, we look at very similar metrics. In some ways, some have said, well, yours are a little bit more restrictive than the state. It's the same category of stuff. We're looking at hospitalizations. We're looking at the number of people tested. We're looking at the test positivity. We're looking at measures that show and demonstrate the impact of COVID-19 on our healthcare system and the burden of disease. So looking at very similar categories, very similar data points. One point that is a little bit different, and the governor intimated this in his press conference on the other day, that spoke about how the CDC has now changed its guidelines in terms of the number of days included in your average. So up until recently, the CDC recommended looking at using a 3-day rolling average, which is what we have done. They changed that this week to say, no, you should actually look at a 7-day approach. And so our statisticians and our epidemiologists are looking at what our data would look like if we were to move from a 3-day average versus a 7-day average, to be able to determine, how that fits in terms of how many days we've met the requirements for reopening. So those are some of the differences where our dashboard differs from the state dashboard, but ultimately the overwhelming majority of the measures that we're looking at are consistent with what the state is looking at, and again, are consistent with what other jurisdictions across the state as well as the National Capital Region are using as their metrics for reopening.
Well, I appreciate you elaborating on that because it's a really important point to note that people think that our measurements are in some way different than other metrics that are being measured, and the fact that they are essentially the same, recognizing that there are socioeconomic and healthcare differences within our jurisdiction, allows for us or requires us to be somewhat different, augment that information. With that, I'm going to support this because it's based on science and data. And I think the measured steps that we're taking are really important. And going back to a comment that was made, a question that was raised by Councilmember Reamer earlier, since his question was asked, I've received some communication that there are some breweries in Montgomery County that are already announcing socially distanced outdoor events this weekend. I shouldn't say outdoor events, open for business. And so clearly the message is getting out, and I expect everybody to be taking their own health seriously, being mindful of everybody else's health, wearing their face coverings, and so forth. So again, thank you for this debrief, and for all of your continued work, you and everybody else who's part of the executive team and part of this conversation today.
Thank you, Councilmember Jawando.
Thank you, Mr. President, and appreciate my colleagues' comment. You know, I'm concerned about where we are in the nation, obviously, but where we are here in the county and in the region. And, you know, I think the messages have been mixed, and it's not particularly clear to me why. So I want to ask some clarifying questions. If you ask the public overwhelmingly, and polls have shown, despite the abhorrent behavior by organized protesters with blatant disregard for their health and safety of the folks that they were near, and also using racist and xenophobic language and imagery, the vast majority of the American public and county residents want us to not open before we should. They want us to be safe. They want us to take our time. They want reopening to happen in a measured way according to science. And so for Dr. Gales, you mentioned in your last response the number of the rolling average from 3 to 7 days in our dashboard. We have not yet met every measure on our dashboard. Is that correct? Under the current way we're calculating it?
That is correct. Not all of them have hit 14 out of 14 days per se. That is correct.
Okay. And so, and then the second question I have, we've heard that health data, we don't want to open before we're ready. And if we look to our neighbors in other parts of the world that have opened more successfully, they've had a couple of things. All right, you there? I think little background noise there, Dr. Gills. They've had the ability to test, to have widespread testing. They've continued to rely and enforce and have social distancing measures, which I know we're certainly trying to do in this order. And they've had a network of contact tracing that can get on new outbreaks. In some places like South Korea, they built an innovative digital infrastructure to identify and track new cases in their borders. I'm concerned, and I want you to address, if we haven't met our metrics and we don't have robust testing, I know we're starting to do better, and we don't, and I know we're getting ready to launch the contact tracers. If that's not all in place, why are we reopening at all?
Hi. So looking at, thank you for your questions and concerns. Those are important observations. So looking at the sum total of the data that we have, the trends are positively moving in the right direction. So even in those measures that we haven't hit 14 out of 14, I think they're 9 to 10 or 11 out of 14 days. And again, are moving firmly in that direction. For example, one of the measures where we have lagged behind in particular is the acuity bed space, where we have, I think it's maybe 1 or 2 of 14 days. That has, even those numbers, for example, the average, we've been asking for it to be under 70%. It's at 70, 71, 71.2. And with the provisions that we have made with the state to increase capacity, for example, utilizing the Tacoma Park campus, that would add up to additionally 200 beds to that number to provide extra space to absorb the surge. There are other measures, for example, our test positivity. Yes, we haven't met the 14-day threshold, but we have significantly improved to the point where even before we launch even larger testing capacity, our test positivity has dropped on a daily average to about 14 to 15%. That's significantly improved from about 30% that we saw over a month ago. So yes, there are some indicators that may not be at 14 out of 14, but they've made significant progress.
Right.
They have been sustained over some period of time, and they've shown significant improvement. I will be very clear with you though, and I hope this has come through in the last couple of months, but want to emphasize is that if there is any indication from a health perspective that we're not ready to launch, I would have no problems being very vocal and very transparent about that. I think this situation is, and it underscores why we aren't moving in the direction of saying, you know, we are open back up for business on a phase 2 level. It underscores why we're taking a measured approach and introducing activities and things that are lower risk on the transmission scale. And we will need to continue to see improvement in those measures across the board before we relax those even more. And I hate to say relax, but before we make provisions to open up things on a larger level.
I appreciate that. And I think that is a critical approach. Also, people have to have confidence that what we're doing is working, and that the businesses understand what they're being asked to do, that residents understand the behavior that they have to comply with, and tracking those numbers while that's happening is important. If you could just speak to the second part of my question around the testing and the contact tracing, which again, if we're going to be able to isolate and know where things are going, those are critical components. I know we're expanding those,
sure.
But where did you talk about that as where we are with that as well?
Sure. So contact tracing, we have been doing to some degrees from the very beginning. And so we will continue those efforts with the staff that we have, and we will now be a part of an integrated system utilizing additional resources from the state that will go live today, actually. They've had multiple go lives in some of the other jurisdictions over the last week. Our staff have been trained on that over the last week. And one of the benefits of this is it will be a shared platform across the state that will allow easier tracking of cases and connecting and contacting and following up with those contacts who have been identified. So the contact tracing piece is up and running. And it's been beefed up with the additional resources that have been provided with the state. The additional resources include over 1,000 contact tracers now that will be housed at the state level to provide initial contact and screening of cases within 24 hours of their results reporting in the surveillance system. And then that will allow for the local health departments to partner with those initial investigations and do some of the premier follow-up with those identified contacts. And so even though that is a new aspect of things, we have been doing contact tracing from the very beginning in some capacity. Now, as it relates to testing, there's lots of great opportunities now, starting with, before we even talk about building even more capacity with test kits, just the fact that now there is clear criteria laid out to test individuals who are asymptomatic. That was it was introduced by CDC a couple of weeks ago, and we've put out memos to our healthcare providers and are working with the medical society to get that information to medical providers in the community to understand, particularly those who are, even though they're asymptomatic, those who are first-line responders, essential employees, and identify contacts of a known COVID-19 case. And so that's been tremendous because now healthcare providers on their own can start testing that group of folks, and individuals who fall into those categories can get access to testing. Now, we are still scaling up our efforts. We have our mobile helpline in place for 2 weeks now for individuals without providers. While I've been on the phone multitasking, we've had a site visit with some partners at CDC, potentially utilizing some of their trailer space to be able to provide services throughout the community. And then next week we will.
Not to cut you off here, but if you could just, how many tests are we doing a week? How many tests have we done if we do this week?
I don't have that exact number for you. What I can tell you is we've tested over 4% of the population in our jurisdiction. And again, our goal is to test 5% on a monthly basis.
Got it. And we're getting there. Okay. And I appreciate it. I just want to emphasize what you said. I think you're hearing from me and my colleagues that we have to proceed with caution. And I'm so glad what you said about if things aren't going the right way, we're not going to rush into a phase 2, because people have to get used to this behavior and figure out how we get to what the new normal is. And I think we're going to have a lot of growing pains as people try to figure out how we live in this environment. Dr. Fauci, great Montgomery County resident, said we will have a second wave. And if we don't get this right and we don't prepare and do it the right way, it's going to be bad. So I really appreciate the deliberative approach we're taking. And thank you for answering my questions. And thank you, Mr. President.
Thank you. And let me just say that I too am supportive of this, of the executive order and the public health regulation. This is a step-by-step process. This is, and hopefully we will not have a second wave. Hopefully that will not come to happen. But if it does, I think Montgomery County has laid a good groundwork for if that second wave happens. There are many things that we will not have to do. We will not have to buy more we certainly have many respirators in place now. We have the hospital beds in place now. There are so many things that we hopefully will never have to use, but if we do, we have done it in a proper way. Every one of us is concerned about the safety for everyone in Montgomery County. And this is an ongoing process. And I think that needs to be on a continuing basis as well. I particularly want to revisit the outdoor religious services. I understand why we're not doing it today. I understand why it's something that has to be discussed, but I do believe it's something that we can, outdoor religious services can be something that we continue to look towards having. We certainly can use the experiences of the other areas, whether they're in Maryland or other jurisdictions close to Maryland, about what they have done. And if their requirements have been less stringent, we can see if by having those less stringent requirements that they work here as well. You know, my colleagues have certainly heard me say many times as I was a small business owner that when we talked about essential businesses, my business by definition would not have been called an essential business, but it was an essential business to me. It was an essential business to my family. And therefore, I think we always have to keep that in mind, that we are affecting people's livelihoods, and we need to make certain that we protect their life as well. So that is something that we need to keep in mind. I want to thank everyone who has worked on this order. This has not been easy work. This has not been rushed work, but this has been good work. And I think that's very necessary to thank the county executive and his entire team for their hard work and their leadership, and to thank the governor, Governor Hogan, for his hard work and his leadership. Maryland has always been noted as America in miniature. We go from mountains to the ocean. Very few places, very few states have that distinction. We do. And Maryland, being America in miniature, is very different through parts of it. The problems that Montgomery County has seen with COVID-19 are very different than our good friends from Garrett County and Allegheny County. So the governor does have different areas to be concerned about. He has different criteria that he needs to be concerned about. But I appreciate the fact that he has allowed each jurisdiction to do what they know to be safe to protect their public. And I also want to very publicly thank Dr. Gales and Dr. Stoddard. There again, not easy work, not always do they get the great applause, but they always need to be appreciated. They're doing what they know to be correct, and we appreciate those efforts. And I just wanted to end on a thank you note for me personally, because I know that this is not something that Dr. Maybe when Dr. Gales went to medical school, that he figured that he would be with the Montgomery County Council more than he'd probably be at his own home. So, and with that, I believe Councilmember Reamer had another comment.
I just wanted to follow up. I appreciated Councilmember Jawanda's inquiries about testing and tracing. And I just, as we move forward, we are going to need an epic, heroic effort on testing, tracing, and isolating. And we're already seeing that the virus is spreading, particularly in the essential workforce and then in the families of those workers, where often they're in housing where distancing is difficult. And if we don't get our testing and tracing and isolating operations up to the scale of this virus, it is going to just run rampant. So I know that we have more testing capacity, but I'm not sure that we are actually implementing that capacity sufficiently. And I know that our tracing operation, while it's beginning, I mean, it's been along the way. I think it could be orders of magnitude larger than it is, and we need to get that to scale, immediately. And as others have commented, it has to be culturally and language proficient in order to be successful. And then isolation has to be offered. If a person is in an apartment with, many people, they need to get out and have a place to stay while they are, in their isolation period. And if we can't succeed with those three initiatives, this virus is going to just absolutely devastate our community as we go forward. And the base of transmission that we are working with now is so much greater, so much exponentially greater than it was in March, from a few dozen cases to thousands and thousands of cases, that as we are loosening things up, it puts the imperative on us to have a successful program testing and tracing and isolating. And so, this has been a matter of great urgency for me along the way. And we just really need to follow through now and build those programs, or we're going to be right back to shutdown. That's the stakes. If we don't have testing, tracing, and isolating, we're heading into either rampant death or we're heading into shutdown. And neither of those are anything that we can really contemplate. Thank you.
Thank you. And with that, I see no other speakers. We do need a motion to approve the Executive Order 070-20 COVID-19 Local Order Phase 1 as the County Council. Is there a motion?
So moved.
It was so moved by, I didn't see anybody who did it. So moved by Councilmember Alberni, seconded by Councilmember Navarro. All those in favor, please raise your hand.
And we don't want to.
And I think we have some background noise, but that carries unanimously as well. And next, we now need to be under the Board of Health, and we need a motion to approve the Board of Health regulation to adopt Executive Order 070-20 COVID-19 Local Order Phase 1. Who would like to make that motion?
So moved.
It was moved by Councilmember Alberni, seconded by Councilmember Rice. All those in favor, please raise your hand. And that is unanimous as well. Mr. Drummer or Ms. Michelson, is there anything else we need to do for this order and regulation?
No, sir, I believe you're done.
Yeah, you're done. You've done everything you need to.
Very
good. On the agenda.
And with that, we thank everyone for being with us. We are adjourned.